correlating clinical, radiographic, and morphologic findings in multiple sclerosis. Introduction. Multiple sclerosis, MS, is a complex and multifaceted neurological disorder characterized by inflammation, demyelination, and axonal damage in the central nervous system, CNS. The correlation of clinical, radiographic, and morphologic findings is essential for a comprehensive understanding of the disease and effective patient management. Clinical manifestations. The clinical presentation of MS is diverse, with symptoms depending on the location and extent of CNS involvement. Common clinical features include fatigue, visual disturbances, motor weakness, sensory abnormalities, and coordination deficits. The relapsing-remitting pattern, marked by periods of exacerbation followed by partial or complete recovery, is characteristic. The correlation of clinical symptoms with disease activity is vital for accurate diagnosis and treatment planning. Radiographic imaging. Magnetic resonance imaging, MRI, is a cornerstone in the diagnosis and monitoring of MS. The hallmark radiographic finding is the presence of focal lesions in the white matter, reflecting areas of demyelination and inflammation. T2-weighted and fluid-attenuated inversion recovery, FLAIR, images highlight these lesions, providing valuable information on lesion burden and distribution. Gadolinium-enhanced imaging reveals active inflammation, aiding in the identification of acute disease activity. The correlation between clinical symptoms and radiographic findings is crucial for confirming the diagnosis and guiding therapeutic decisions. Morphologic changes. Histopathological examination of MS lesions reveals a triad of demyelination, inflammation, and axonal damage. Early lesions exhibit paravenular inflammation, predominantly composed of lymphocytes and macrophages. Oligodendrocyte loss and demyelination follow, leading to the formation of characteristic plaques. Chronic MS lesions often display gliosis and axonal loss. The correlation between morphologic changes and clinical symptoms enhances our understanding of disease progression and severity. Correlation in clinical practice. Integrating clinical, radiographic, and morphologic findings is crucial for establishing a comprehensive management approach in MS. Neurological examination findings guide the initial clinical suspicion, prompting further diagnostic evaluation with MRI. Radiographic evidence of lesion distribution and activity corroborates clinical observations, aiding in the determination of disease subtype and severity. In certain cases, such as suspected tumefactive MS, the correlation between clinical and radiographic findings may prompt the need for additional morphologic evaluation through biopsy. Conclusion. The correlation of clinical, radiographic, and morphologic findings in MS is imperative for a holistic understanding of the disease and its management. Advances in imaging technologies, coupled with insights from histopathology, have enhanced our ability to diagnose MS, predict disease course, and tailor treatment strategies to individual patient needs. Future research endeavors should continue to explore the intricate interplay between clinical manifestations and underlying pathological changes, further refining our understanding of MS and improving patient outcomes.